Hi, I'm Sophia Aragon, registered nurse and executive director for the Washington Center for Nursing. It's Nurses Week, and it's also the year of the nurse and the midwife. But we had no idea what the year 2020 had in store for our world. So we're going to dive deep into the discussion of your well-being as a nurse with public health figure and leading nurse advocate, Stephan J. Torres. Welcome, Stephan.
Thank you for having me.
In the midst of all the changes in our world, why is self-care so important?
Yeah, I'm not even telling people to incorporate self-care into their life anymore, okay? For our mental, physical, and spiritual well-being, I'm telling people at all costs they need to avoid self-neglect.
And what do you mean by that?
Well, given the circumstances we're in today, if I was a nurse that just worked 36 hours and I turned this on and heard someone say, you need to be getting 7 to 8 hours of sleep, I'd say, what is this guy, delusional? Right? What fairy tale is he living in, okay? Don't need this, click, right? They'd be right to. But this is not a HIPAA module that you're going to want to skip through or click to the end of. These are real-world actions that we need to take.
Can you elaborate on that a little bit?
Sure, yeah. There's become a new norm, and it's definitely a dangerous one. Nurses are working 36, 24, 18-hour shifts, and that's just not acceptable. And believe me, I've been there. I've done it. The mentality is, I got to help out my team. Well, I can do this, or I have to. What everyone has to remember is, think back to orientation. There was not a single time that I went through orientation, and I went through a lot of them, that the question wasn't asked, whose safety is most important? And it always catches a few people. A lot of people say the patient, right? And then the nurse educator, the nurse executive, the nurse fill in the blank will say, wrong. It's yours. You never put the patient's safety before your own. And they're right, and always have been, okay? No matter how compassionate and self-sacrificing you are, it's not the prudent thing to do, okay? And despite the drastic changes that have happened in our world, the rule still applies. And fundamentally, it always will. Because if it didn't apply, then you would be compromising your own safety, your patient's safety, your family's safety, everyone's safety. And that is opposite of being a prudent nurse.
So how should we approach self-care differently today than we have before?
Yeah, with a totally different attitude, okay? If this was last year, I would expect nurses to watch and say, those are good ideas. I might want to incorporate that in my life, right? This year, the attitude needs to be, I will not jeopardize my own safety by not incorporating these things. Caring for yourself has all the key components, same as they were before. The only difference now is that it's not an option to not do them. If you're a nurse, I don't need to be asking how many steps you got in, okay? There's no more weight loss challenge at work. We're not checking our cholesterol every quarter. Okay, times have changed and we're in survival mode now. And what we have to look at is what survival mode incorporates.
And you mentioned these long shifts, sometimes 2 or 3 in a row. How do you survive that?
The simple answer is that you don't. You won't, okay? You will break at some point. Okay. Nurses are a resilient and strong tribe, and there's a lot of them out there that'll say, I can do this, or I have to. But truthfully, you can't, responsibly, and you don't have to. We've all heard the studies about, 12-hour days, more dangerous than 8-hour days. And nurses, I think, as a whole have agreed that 12-hour shifts are fine. Sometimes we'll pull 16, but that was back then. Now times have changed, right? You've got nurses doing 16s every day and sometimes pulling all-nighters. So while we're a tenacious and resilient tribe, we have the responsibility to understand what our responsible limits are. So I'm not going to tell you to go and get 7 to 8 hours of sleep. You know this. We've been hearing it our whole lives, okay? What I'm telling you is to use the strength and intelligence that you have to say, no, I'm clocking out now to go and get it. Because maybe you want to keep helping. Maybe the extra money will cover the cost of some things. But it'll also cost you your energy, your well-being, your sanity, your happiness. And the more you sacrifice that responsible balance between work and rest, the less you can afford those things.
Thank you, Stephan. I'm looking forward to talking more tomorrow.
Absolutely. Thanks for having me.